May 6th to May 12th is Mental Health Awareness Week. So we thought we'd do a video about mental health. 1 in 5 Canadians have or will develop a mental illness throughout the course of this year. That is a high number, but what's sad is that only half of those people will actually seek treatment or already have treatment. Meaning that half of the people who have or will develop mental illness throughout the course of this year will not seek medical treatment. These people either tend to cope with the disease on their own or self-medicate through drugs or alcohol. We talked to Dr. Smita Naidoo out of Maple Ridge about mental health and what it means to be mentally healthy. We also asked her how one would go about determining if they have a mental illness and what resources are available to them. Thanks for coming in and talking to us today, Dr. Naidoo. I mean, one of the things that we want to find out is, what does a mentally healthy person look like? I mean, we know what a physically healthy person looks like. I mean, we have definitions of what that would be, but how would you define a mentally healthy person?
Well, that's a really interesting question because, like you said, someone that's physically healthy can be seen. Mental health is kind of the invisible problem. And the weird thing about it is that if you have high blood pressure or if you have diabetes, there is an algorithm and we know when someone is diagnosed with that. However, let's say you're depressed or I'm depressed, our thresholds of depression are totally different. So what's interesting about that is that there's no universal, quote unquote, healthy mental health person across the ages. And what's important to know about mental health and mental wellness is that everyone's definition is very unique to each person.
You deal mostly with teenagers up to about 25. You're 23, 24, 25. That is a very stressful time in a person's life. Not only are you dealing with school, there's also now issues of bullying and what college you need to get to, your career. Then there's the whole college aspect of it. Then there's finding your first job, figuring out if this is what you really want to do. Those are all things that happen during that time period. Why is it not just stress? That's a very stressful time period. Why would it be mental illness? Why isn't it not it's just stress?
This is a unique jar that represents me and my capacity to hold a certain level of stress. Well, before we're all born, interestingly, just like high blood pressure or diabetes, we all have a genetic code that's written for us that says, oh, well, my uncle had diabetes. My great-grandfather had diabetes. Therefore, I have more of a chance before I'm even born, right? To have a predisposition to having diabetes because it's written in my genes. What's interesting about genetics is that we actually know for sure that all mental health illnesses have a genetic component, anywhere from ADHD to depression to addictions to anxiety disorders. Okay, so now imagine, so your question is really good because it's like, well, it's such a stressful time, like basically from puberty all the way through to 25 and beyond. So how do you account for that? Well, actually, we do account for that. So again, this is my jar. Now, let's think about my teenage years. Well, let's pretend for a second that I was going not only through the regular puberty and difficulties keeping up with academics and finishing high school. Let's say I was bullied. Just puberty in itself. All of us, let's say puberty was, would equate to me adding this into the jar for all of us. Puberty is very stressful. Okay, so it's getting more full. Let's say that I don't get into the university I wanted. Let's say I'm having a lot more stress in my relationships, either romantic or whatever. And before you know it, I'm going to have a very full jar before I'm even 25.
Right.
Why that matters is that my threshold now, as you can see, I have very little space in my container, which represents my mental health. So what happens, why we get mental health issues, is that when our jar is overflowing and we can't fit the lid, right? That's how I represent what mental health is. It's by the time you've added on your genetics, your predisposition, and then you keep adding stressors throughout the year. It doesn't have to be one stressor. It's usually the combination of multiple stressors, which lead to disease.
I guess my next question then is, how do you know that you have a mental illness? We don't talk about this mental illness or mental health essentially in regular everyday topics. It's not something that's really discussed very often. So I feel that most people aren't going to know that they have a mental illness until someone actually tells them that they have one, if you know what I mean. So, like, how does one go about figuring that out? Like,
first of all, you're right to say that most people are just kind of going to put their heads down and ignore it because it is invisible, number one, right? Number two is it gets confusing because your definition of what it feels like to be anxious and my definition, as I said, are not universally the same. Sure. So that's the second thing. So it's very hard for someone that doesn't talk about feelings and emotions to even know where the heck they are on that scale of anxiety and depression compared to their friends. So how we would actually know is, think of it this way, is if you're not functioning, if you think you're not functioning or your friends or your family think you're not functioning to your potential, your unique potential as an individual, you need to start having a language of checking in with yourself every day. You know, even if it's 30 seconds, you don't have to write it down. I'm not telling you to like journal it. You know, that would be amazing if you could, but most of us don't have time. And if you're just starting to learn the language of your emotional state and how your body feels. But it is, it is a really good check to see how you feel and to maybe even jot it on your phone or do a voice like note and say, okay, well, today was a really hard day and my energy was low and I'm feeling 4 out of 10 today. If you added all that data over the next even 2 weeks, you'll start noticing a trend. So I think the most important thing is the big picture is how is it affecting your function in 3 domains: socially, occupationally, or academically, and other, meaning like hobbies and passion. And then the next thing is, okay, if other people are not noticing, you're going to have to do some self-reflection every day just to check in. The main 3 things, again, that will tell you that you have probably some issues around mental health is exhaustion, feeling extremely irritable and being angry when you're not an angry person, or starting to isolate. So staying in your room or canceling on friends or making plans and canceling them.
let's say someone has come to the conclusion that they might have a mental illness. What is their next step? Do they go see a psychiatrist? Are they going to a psych ward? Like, what is it that they need to do to move forward with this?
So the first thing to know is that we're actually very well supported in the province. The second thing is there's many different things, especially for youth, on the internet. So there's a helpline for children. But the way, aside from all of these readily available things on the internet, most people, I would say, if you're feeling something, you got to ask and tell someone. So that person would be your family doctor, first of all, is just letting them know, hey, I barely come in here and I just want to know if things are okay. And they have screening tools that are very quick that they can do. And those questions are very specific to depression and anxiety and ADHD. And from there, very often the family doctor might, or the walk-in clinic might want to see you a second time just to make sure if, what the next steps are. But what I would say is not to panic. And then the second thing is that you might end up in the hospital. That's not true. It's just that people get really, really worked up over mental health, thinking those things. And I'm glad you brought up that statement because what we'd rather have is way more people going in before they're depressed or anxious or have ADHD than later on in the game, because then it takes longer to treat.
If someone has just been diagnosed with a mental illness, what do? Do they have to inform their employer? Can their employer fire them because of it?
That fear makes sense to me because it's happening in a culture that is so afraid, right, of any kind of label. What I will say is that having a diagnosis is in mental health is no different from diabetes. Are you going to disclose to your employer or your school or university if you have a thyroid illness? No. Or diabetes. It's no one's business. It's a very private matter. When it comes for an adult and employers, it's no one's business. Right. And by no means is there any legality there that you have to disclose that.
Now, taking away the extreme cases of mental illness, and you're dealing with mild to moderate cases, are most mental illnesses easily treatable?
Having a label or a diagnosis of a mental health issue is really important. It's as important as it is for diabetes or high blood pressure, so that the next doctor that sees, right, that if you have high blood pressure again, they can look back and see what you did. And depression doesn't just vanish. ADHD doesn't vanish, anxiety doesn't vanish. You're optimizing your brain every time. So anytime that your doctor has more data or more information to know, oh, like Smita Naidoo was treated for anxiety from, let's say, 15 years old to 20, and this was the medication she took. And guess what? In my mid-30s, let's say I develop an anxiety disorder again because I'm going through a really hard time at work. That medication is very likely to work on me again. This is such an exciting time for mental health, and I think why there's so much more awareness as well is because if we get people in sooner than later, they get better quicker, right? That's the bottom line. There is so much more wealth of information when it comes to how the brain works and how we can treat it. I would say that, even in my practice, when I look at those that have come in, quote unquote, later for a mental health checkup, and then they might have an anxiety disorder, depression, they're better in less than 3 months, the mild or moderate ones. So it is absolutely life-changing. Most of the mental health issues, like you said, if we're looking at mild to moderate, absolutely treatable. There is, and with very little side effects now. So I think that's the other thing to be clear, is that the reason there's so many resources now and so much time and energy put in to understanding where you are on that spectrum of mental health, if you are, is that there's help for everyone. And the most important part is believing in your treatment. If you believe in your treatment, you will likely, in a mild to moderate kind of mental health issue along the spectrum, you'll get better within 3 to 6 months.
As Dr. Naidoo said, seeking treatment for a mental illness allows you to be the best you that you can be. If you have a mental illness and you'd like to share your story in the comments, we'd be more than happy to listen to it. And if you know someone who might have a mental illness but hasn't gone through the process of actually discovering it themselves, please share this video with them.